Hello, my name is Corbin Irwin, and this is a presentation for CYB 650, Innovation in Cybersecurity Frameworks. Our objectives today are to discuss implementation of the NIST, National Institute of Standards and Technology, Cybersecurity Framework for the Augusta Medical Hospital. We're going to be identifying the business needs, concerns, and efforts, and how they affect the framework implementation. We're going to identify the specific regulation requirements and the organization must meet. Identify risks in the organization and how they can be managed. We're going to discuss privacy principles concerning data collection and use, and discuss the legal and regulatory requirements and their impact. So let's talk a little bit about Augusta Medical Hospital. Let's look at the mission, vision, and values. Our mission is to provide leadership and excellence in teaching, discovery, clinical care, and service as a student-centered comprehensive research university and academic health center, with a wide range of programs from learning assistance through postdoctoral studies. Our vision is to be a top-tier medical facility that is a destination of choice for healthcare, discovery, creativity, and innovation. Let's go to the values. Collegiality, reflected in collaboration, partnership, sense of community, and teamwork. Compassion, reflected in caring, empathy, and social responsibility. Excellent, reflected in distinction, effectiveness, efficiency, enthusiasm, passion, and quality. Exclusivity, inclusivity, reflected in diversity, equality, fairness, impartiality, and respect. Integrity, reflected in accountability, ethical behavior, honesty, and reliability. Leadership, reflected in courage, honor, professionalism, transparency, and vision. From this, we can gather that this is a place that wants to be a top-tier medical center to not only set the pace for the students that attend there, but also for the patients that they care for. So now that we know a little bit about the medical center, let's talk about the organizational efforts and prioritize them. We've been hired on to do a couple different projects that'll beat business goals, but also increase the security. The organization has been the target of several different ransomware attacks, and they're trying to mitigate future risks. So first, upgrading the system. The current information system is very important. The system currently used by Augusta Medical Center, or hospital, is outdated and needs to be updated and upgraded to meet the new business needs. The upgrade includes new software applications, hardware, network components, and structure, and integration with the hospital's hardware and software solutions. So what we're looking at here is an upgrade to all of the information system, not only the security components, but with that, of course, the need for more security is seen. We need to secure this information system. This is our second goal. The current information system lacks a proper information security policy and framework, which has led to Augusta Medical Hospital being the target of several cyber attacks. We need to secure the system by implementing the NIST framework as a top-tier priority to ensure that patient information and company assets are safe from further attack. Lastly, we need to meet regulatory compliance. With new regulations in place for the healthcare industry, Augusta must implement new controls and policies to meet the regulatory standards. These standards must be met to ensure the safety of patient information, but also to avoid fines and penalties. So let's talk a little bit about the medical system, the new information system, and its requirements and prioritize them. First priority is the communication and system access requirements. The new system needs to integrate with in-place systems to give access to electronic medical records, protected health information, electronic health records, and personal health records. So all of the record systems of the past need to be able to access the current systems. So the new electronic health record system will be able to basically bring all of the past records into one place where they can be accessed. The new medical system should also be able to support staff being able to chart, complete and access insurance claims, and access all departments. So we need interdepartment connectivity. Additionally, all the medical imaging should be accessible from within the system. So CT scans, X-rays, MRIs need to be accessible as well. The new medical system also must be able to transfer electronic health records securely to other healthcare providers. So if another clinic needs information about a patient we've seen, we need to be able to transfer that information securely. We'll talk about how we're going to do that in a little bit. Second priority is patient access to records. The new system should be able to support patients accessing their records remotely over the internet, such as medical histories, including diagnosis information, labs, and treatment plans. Lastly, our third priority is extend user-end functions for patients. The new system portal should be able to have the ability for making appointments in the patient portal, and it should also support billing payments in the patient portal as well. So now we know a little bit about our priorities, who Augusta is, where we're trying to take things, and what our goal is overall, and that is to integrate with NIST. So what is the NIST Cybersecurity Framework, and why should we use it? Well, the NIST Cybersecurity Framework, or National Institute of Standards and Technology Cybersecurity Framework, is based on a collection of standards, best practices, and guidelines. These comprehensive collections are used to create a framework that organizations can utilize to design and implement cybersecurity risk assessment and management processes. The framework is designed to work with organizations of varying sizes and can help improve all cybersecurity programs. The Cybersecurity Framework provides organizations with flexibility, adaptivity, allowing them to improve their overall security posture. So there's a couple different components to this. The Cybersecurity Framework has 5 core functions, which is identify, protect, detect, and respond. We're going to talk about that in the next slide. The framework also has 4 implementation tiers, where we're able to see kind of where we are at with actually integrating with this. So partially, we have it a little bit, knowledge of it. We've kind of looked at some of the risks, but we're not there yet. Risk informed, we know more about the risks that we have, but we don't have processes to deal with them. Repeatable, where we have processes, policies, controls in place that can be repeated, and then adaptive, where we're able to actually respond effectively to risks, and we're able to respond quickly. The framework also has profiles, which can be used to create different functions, so we're able to better align with business needs, with resources, risk, and risk tolerances of our company. So let's talk a little bit about how we're going to get Augusta to align with the NIST Cybersecurity Framework. We're going to talk about the different functions here and some of the different ways in which we're going to do this. So first we need to identify the different things that might be threats or things that we need to protect or things that are in place or assets that we have. So we're identifying a bunch of different things here, and that's one of the core functions. So as we can see, we have identified that we have a lot of different medical type records. If you look at our screen here, we can see our pointer, a lot of different medical records here that we need to protect. We have a patient portal and API. That's another asset that we have. We have servers, outward facing services. Those are things we need to protect. And we have our internal software and hardware. Those are things that we have as assets. We have all of our actual physical equipment, our physical assets such as buildings, vehicles, medical equipment. Then we have our risk assessment and risk tolerances. So these are the things that we have to identify. Then we have a critical infrastructure element, power, water, internet connectivity. We also have our staff resources, so our actual staff are things that we need to identify that we might have to either incorporate into other functions or that we need to protect as assets. And we have our current cybersecurity policies and processes. So obviously those aren't working very well, but it's good to know where they are so that we can then start to integrate better and align with the NIST framework. So how do we actually protect things here? Now these don't directly relate across the way here, but this is the identify function. Now we're going to look at the protect function. So how do we protect things? Well, staff awareness and training is important. It's something we want to do. Access control policies for electronic health records and patient portals is very important. We're going to identify management for both staff and patients using multi-factor authentication, identity management for both staff and patients. We're going to utilize encryption for all data in all states. So whether it's being transferred, whether we're storing it, we need to make sure that it is being protected at all of those times. We're going to utilize network segmentation to separate external and internal facing components. We're going to utilize firewalls and intrusion prevention systems to block attacks. We're going to secure physical access to systems and networks, utilize smart card access for doors and computer access, and we're going to create a patching policy to ensure that the systems are up to date. We're going to create contingency plans for critical infrastructure, so our water, power, connectivity. And then we're going to create policies to address gaps identified during our risk assessment. So some of these things are unknown based on the information we have, but we're going to do our risk assessment and then we'll be able to protect things better based on that. So once we have things protected, how are we actively detecting? Well, within our alignment with NIST, we're going to use an intrusion detection system, regularly audit logs, so access logs, network logs. We're going to use a data loss prevention solution. We're going to utilize a security information and event management solution to make sure that all of our different logs, informations can come into one place so they're easily viewed. And we're going to regularly audit security programs and its effectiveness. So the components of the security program as well as the overall program will regularly be audited to make sure that it's working for our intended needs and aligning with #1 business functions as well as NIST. So, should an incident happen, how do we respond? This is the other one of the other functions. We create and maintain an incident response plan. We have roles and responsibilities in place for our team within that plan, and we have methods of communication that employees and stakeholders can use should something happen. We utilize a contingency plan for our electronic health record system to make sure that patients and nurses and doctors and everyone has access so we can continue to give care. And we create an analyst team to quickly identify and understand attacks. So this is one of the components that's very important. Once we have detected an attack, we need to make sure that we understand it properly so that we can then respond properly. How do we recover from an attack? Well, we created a disaster recovery plan. We create a business contingency plan so that we're able to keep the business going while we're recovering. And that'll include backups and different systems, having access to backup data, maybe some different infrastructure elements. We ensure that all information is backed up and can be recovered. We have our legal and PR teams ready for required notifications such as breach notification and other legal obligations that we can see within certain different standards. We'll talk more about that. We have clear communication channels for our stakeholders, and we implement improved processes and policies from lessons learned. So once everything's wrapped up, we come back to this and we make sure that we are learning from our recovery processes. So now that we know a little bit about how we're going to align with the NIST security framework, we're going to talk a little bit about some of the regulatory requirements. Now, HIPAA is a big one. This sets standards for healthcare containing private healthcare information, patient privacy, and breach notification. So you must always follow that. We have a new one that's called high tech. This one extends is an expansion of HIPAA and deals more with the use of technology within the healthcare environment. It lays out technical and physical controls that should be in place when using electronic health record systems, for example, to safeguard information. It also has much more strict penalties for breaches containing PHI. Joint Commission is another one that is not necessarily a requirement, but it is a standard that gives certification. So it's important that we get that accreditation for healthcare because it means a lot. These standards extend to patient information security and patient privacy. All data protection measures must be met in order to get the accreditation. So they have their own standards as well that we must follow. Then we have the Centers for Medicare and Medicaid Services Electronic Record Incentive Program. This has different requirements for privacy that you must follow in order to get different incentives for using an electronic health record system. It makes everybody's job easier to use a system, but you must follow certain patient privacy and data security requirements. Otherwise, it won't pay out. Then we have the Food and Drug Administration 21 CRF. This regulation applies to the use of electronic records and signatures in relation to medical devices and clinical trials. The regulation helps ensure that records are of the highest integrity and authenticity. So basically, if you're using electronic signatures, you're using different types of equipment in clinical trials or research, you need to follow these standards for that to be legal. Because Augusta is in Georgia, we do want to look at some of the Georgia requirements. The Georgia Department of Community Health has several different regulations. The regulations create standards related to electronic health and patient data protection that healthcare organizations must follow. Then we have the Georgia Breach of Personal Information Notification Act, and this outlines what we must do should personal information be breached and how we must notify people. We've talked a lot about risk and risk assessments, cyber attacks, ransomware, but let's talk about the elements of cyber risk. Number one, there's threats. This is the first element. Threats are software, groups, or actions that have the potential to cause harm to an organization. Some examples of threats are malware, phishing attacks, ransomware, denial of service, and insider threats. All these have the potential to do damage and must be considered when examining risk. Next, we have vulnerability. So threat, now vulnerability. A vulnerability is a weakness that is found within an organization's information security that could be exploited by a threat. Some examples of vulnerabilities are zero-day exploits, software errors, buffer overflow, injection attacks, hardware errors, access to dev modes via USB connections, for example, and physical security. An example of that is broken locks on server room doors. So we have a threat, something that could potentially cause harm, and then we have a vulnerability where that threat can exploit. And then if they do exploit it, we have consequence. So the consequence of a threat exploiting a vulnerability can be monetary, as seen with the recent ransomware attacks that have taken place here at Augusta, or the physical damage to hardware or loss of reputation with patients. And these are just a few examples. There's obviously more consequences that could happen. How do we take care of threats? Well, that leads us to mitigation. Efforts to mitigate risk should include risk assessments, strong technical and administrative controls, creation and implementation of strong information security policy, regulatory compliance, and well-trained employees who understand the importance of cybersecurity. So let's talk about our organizational privacy principles here at Augusta. There's a couple different components we're going to talk about: the collection of privacy information, the disclosure of that information, and how we're retaining that information, so retention. So in collection, when we're collecting information, we have informed consent for all information collected, ensuring compliance with all regulatory requirements. Minimization means we are going to minimize the amount of data that we're collecting and only get what we need. We're going to create and release a data use transparency report that tells people how we're using this information. And we're going to use data validation to ensure that all the information we are collecting is correct. So how does this information used and disclosed? Well, data sharing agreements ensure that patients have consented to the sharing of their information and that there are the required technical safeguards in place with third parties whom the information is being shared with. So if this information goes to anyone else, we're making sure that it is legal, patients know where it's going and how it's being used, and that it's safe. We're going to use anonymization of data whenever data is used for public health efforts or research. So if we're looking at a large amount of data, we're going to try to anonymize that and remove any identifying factors from it and just the components that we need for our research. We're going to use the need to know principle of least privilege. So access to patient information should always be limited to the fewest possible people. Only those who need access to provide quality care to the patient should have access, and access should only be for the period of time they need for the care. Implementation of patient portal, where patients can access and request copies of all the collected information, is also going to be implemented. So they can look at all the information we've collected and they have a little bit of control over that, which is important. So information retention. All stored information is encrypted to meet regulatory standards. All patient information is kept in secure services that utilize strong network and physical security measures. If a third-party server is used, third-party agreements that outline minimal security controls are in place. Augusta will also regularly audit all third-party services. Backups are made of all data, and information is regularly checked to ensure integrity. The information is only kept as long as it is needed for patient care, and then it is disposed of. So we're not keeping data any longer than we need to. So lastly, let's have a little discussion of regulatory standards. So the impact of regulatory and legal standards. Obviously, there's a lot of different ones that we talked about. How does that affect us here at Augusta? Well, there's some advantages. Patient and company information is more secure because these standards have a lot of security with them because of all the different controls that they require. We have increased customer and patient trust because they know we're meeting these standards, so we're going to be safer. Insurance rates can be lower because we're meeting different standards or accreditations, so they can see we're at less of a risk. And beating compliance can minimize attacks and breaches, which obviously from the past ransomware attacks, minimizing that's going to be great. Save us a lot of money. We also can get higher uptime and better availability to the information that we have. Again, ransomware cut down on that, but meeting regulation will keep our systems more secure. Now, there are some cons. Cost of doing business can increase, so it is costly to meet these regulatory standards. Increased time for new medical technology development, as well as higher costs. So new technology has to meet these standards as well, and we need them to be compliant with these standards, so it's going to cost us more to get new medical technology and equipment, and it's going to be longer to develop. Now, should we fail to reach compliance, we can be fined and penalized, so that can be expensive. And employee time spent on tasks may increase due to security and privacy measures. So two-factor authentication is a good example of this. It takes longer for people to log in. And if we have different systems securing different information, it can take a lot longer. But that's why we're using the electronic health record system to hopefully minimize that. So as you can see here at Augusta, we are really working to integrate well and implement the NIST Cybersecurity Framework and make sure that we are meeting regulatory standards. Please check out this slide and look at all the different references for the information I've used today, and have yourself a wonderful day.